Well, to be on a hefty dose of Proargi Plus can cost $100 to $200 a month, depending upon how high the dose needs to be. And then that needs to translate to what medical conditions you're managing. And there's cost in dollars and there's cost in potential side effects from other therapies. Let's take, for example, high blood pressure. The good news in the prescription drug industry is there are a lot of $4 drugs for treating high blood pressure. They can be on $3, $4 drugs for hypertension. Sometimes it's very well controlled. Sometimes it's moderately well controlled. Often you're getting either lethargy from the beta blocker, fatigue, problems concentrating, leg cramps from the calcium channel blocker, a dry cough from the ACE inhibitor. So you have side effect cost that you're compromising in order to get blood pressure control. And the drugs are directed to just control blood pressure. They're not directed to rehabilitate your circulation and open adhered endothelial cells and improve nutrition into your cells and remove waste products of metabolism, because they're not arginine converting into nitric oxide, which does all of that. So one of the great benefits of arginine is you're affecting multiple systems at once in a biologically therapeutic fashion that's almost hard to account for, because there are so many benefits that are happening simultaneously. So what ends up happening for a lot of people who take arginine is they feel better in more than just their blood pressure control. Their erectile function improves, their circulation improves, they lose a little bit of weight because they detoxify, their nutrition into their cells improves. So now $100 a month isn't sounding so bad, because you're not getting side effects on the one hand, and you're getting additional benefits beyond just blood pressure control. So it's a discussion that needs more sophistication than just talking about dollars and cents, because there's more cost involved with side effects and multiple additional systems being benefited. And that's common, but it's common in natural medicine for something that you do or take to have multiple areas that it benefits. But I have never seen anything that covers as much ground as arginine does, and how many beneficial systems are affected. I mean, you're breaking up glycosylated end products, you're opening up endothelial cells that are adhered, you're improving circulation to all the cells and tissues throughout the body, you're opening up blood vessels that have been shut down for a long time in certain systems. You can improve heart failure, kidney failure especially, because there's a tremendous amount of circulation in the kidneys. It's excellent for chronic lung disease because it opens up the epithelial lined surfaces of the lungs where oxygen is exchanged into the small capillaries, and there's more endothelial cells in and around the lungs than anywhere. So people with chronic lung disease that may also have high blood pressure end up having reductions in shortness of breath, and their blood pressure gets controlled. And what's going on here? How come I'm breathing better and less short of breath? I thought this is just going to open up my arteries and help my blood pressure, and yet it's helping multi-levels of systems simultaneously. That if you have any of the conditions that arginine helps, you want to choose it first and prescription drugs last, even if they're $4 drugs, assuming you can afford it.
Dr. Milner, I just wanted to tell you thank you very much for spending the evening with me and talking to us about Proargi Plus.